Legislative panels are, they're really policy hearings, which are official, meaning this is a Democratic policy hearing. Our friends on the other side also have policy hearings, and we appreciate Chairman Bizzarro for allowing us to host again one of these policy hearings here at our Disability Summit, both today and then as well as tomorrow. So we thank him for that. So we do have two topics today that we will be going over. So our first topic is going to be in relation to access to quality assurance checks for complex wheelchair users. We will be switching through speakers who are going to come up here at the microphone, and they obviously have prepared testimony. They're invited to not read it if they don't want to. They could just talk to us, whatever they like. And then the legislators will also ask questions about the testimony to kind of flesh out any issues that were brought up. And now I'm going to ask my friends who have joined us up here to introduce themselves, make sure they tell us who they are and where they're from. So starting all the way to my left.
Hi, everybody. I'm State Representative Jessica Benham. I represent the 36th Legislative District, which is much of South Pittsburgh and then Mount Oliver Borough and Brentwood Borough. And as somebody who is openly autistic, I always enjoy this summit every year. So thanks, Rep. Miller, for having us.
I'm State Representative Anita Kulik. I represent the 45th Legislative District. That is everything from Bridgeville through to Neville Island. And I am also chair of the Game and Fisheries Committee, and I am proud to say that between the Game Commission and the Fish Commission, we are learning to make accommodations for our friends with disabilities.
Good afternoon, everyone. My name is Ariane Abney. I have the pleasure of representing all of my neighbors in the 19th Legislative District, which is in the city of Pittsburgh. My background is I am a social worker by educational background, so this is a topic and conversation that is near and dear to my heart. So thank you very much for having me.
Hi, I'm State Representative Joe Hohenstein. I'm from New Jersey. Actually, I'm from Philadelphia. Right on Delaware River, I can see New Jersey from my district. I just love coming to this session with Dan and sharing in the work for people with disabilities, making sure that they've got their rightful place in our society.
Well, and I want to thank all my friends who've been here, not only now but in previous years, and I know some more are en route. We'll introduce them as they come in. Again, it's a great panel. Jess has been very involved with our summits in years past. Anita, in a lot of ways, helped host it almost because she and I represented Scott Township for so many years in this community, which is great. Ariane's kind of like filled in exactly for his predecessor as well, being here over the last couple of years to support the disability and mental health. And Joe obviously comes the furthest. And the thing I appreciate about Joe, too, if you guys are ever out in Philly, especially in the fall, I think September, Joe does his own version of this, I think in a partnership with Temple.
And Philadelphia Arc. Our one is going to be on October 3rd. We only have one day, Dan.
Only one day.
No.
Only one day. Eh?
Yeah, you know.
Yeah. So, but Joe does a tremendous job. I was out there this past fall as well, and so we really appreciate that. Now, that being said, thank you again, everybody, for introducing yourselves and for being here today. We're going to go right into talking about our wheelchair users. In particular, it's a bill that I think we've had for 2 terms now, and we are trying to gain traction to talk about the issues that come up and how we can have them wheelchairs get more coverage, better coverage, and therefore be more usable, more comfortable, and more appropriate over their lifespan. So that being said, I want to thank all of our speakers as well. And is it Matt first? No. Yeah, Dr. Schmehler. Schmehler, I apologize. Yes, I don't have it in front of me. So, Doctor, thank you so much. We'll go to you. Appreciate it.
Oh, thank you. All right. Well, Representative Miller and the rest of the legislatures, thanks for this opportunity. My name is Mark Schmehler. I am an occupational therapist by background. I'm also an assistive technology practitioner or professional. My role, I'm coming to you as a clinician, as an occupational therapist. I've worked in this field for going on 35 years now. I don't know much, but I do know wheelchairs. So I serve as the director of the Center for Assistive Technology at UPMC, which is an outpatient clinic. We see about 2,000 people per year for a variety of assistive technologies, including communication devices, computer access, home automation, adaptive driving, pretty much the whole gamut. My area of expertise or clinical focus has been on wheelchair seating and mobility. We see about 1,200 people a year for their wheelchair needs. Now with that, I'm also an associate professor and the vice chair for clinical service and policy in the Department of Rehabilitation Science and Technology at the University of Pittsburgh. I've been there for 27 years. So with my clinical work that I do, which is about half my time, the other half of my time, I am fortunate to manage very large data sets, real world data about people who use wheelchairs. And I also work with a very qualified team of people, including clinical investigators, statisticians, data scientists. So we are now able to look at how these devices are used, who uses them, when, but more importantly, we're looking at what is the overall reasonable useful life of the devices and what tends to happen to them over that reasonable useful life. So the reality is wheelchairs break, okay? That's not because they're poorly designed. They're just designed to do a multitude of things like move people around, shift their weight. There's a lot of complex components to them. It's because they're not maintained. Well, maintenance is a way to stop them from breaking. So if you think of your car, and I don't like to compare wheelchairs to cars, but it's something that most of us can relate to. If you don't change your oil, if you don't put air in the tires, if you don't check your alignment, you're going to have other problems. Wheelchairs are very similar. We've looked at over 60,000 repair claims in a database that we have. On a manual wheelchair, your tires, your casters, your bearings, your forks, your wheels, your spokes, your footrests, your armrests are all components that have wearable time to them. They do fail. The problem is we don't do enough maintenance on them. On power wheelchairs, it's those same components, but also the electronics and batteries now become the primary thing that we're concerned about. So we also know that these devices, these components, fail somewhat predictably. We're still working on that research, but what we're trying to do is come up with timelines of when it makes sense to replace parts, just like we would on a car, changing the filter on our furnace type of thing. So that's why the bill is so important. Right now, we can't fix parts on wheelchairs until they actually break. There's no coverage policy for maintenance. So people who use wheelchairs often have to wait till something goes wrong and then ask for a repair. And in that timeline, in that situation, catastrophic things do happen. So going back to the research, and this research I'm going to be talking about throughout here is been listed in my handout or my testimony that I provided. It's all scientific, peer-reviewed research. We prefer to talk about things that actually have been published or about to be published because it is science. So what is the science telling us about wheelchair repairs? A study in 2009 showed that about 45% of wheelchair users experienced a failure within a 6-month period. That's almost half. 2022, same researchers, now we're up to 65%. And it's not, again, because wheelchairs are poorly designed. It's probably because we're not repairing them. And the other thing that I think is a good problem, people with disabilities are getting out of the house and they're doing more things, and we're expecting more of them, and we need to continue to support that. That's what we want, community independent living. But you can't have community independent living if you've got devices that you're not quite sure if they're going to get you to where you need to be, and sometimes you might just be afraid to leave your home, not go to work, not look for a job, because your wheelchair is what's stopping you from feeling comfortable to do that. So I talked about the incidents. When a wheelchair does fail, 20 to 40% of people who had the failure experience a catastrophic situation. And I'll tell you, catastrophic situations are things like falling, getting pressure sores, so you're stuck in the house, you're in bed, you're getting bed sores, You're going to have contractures. You're going to have pain. Let's not talk about quality of life here. You can't get to appointments. You can't go hang out with your family. You can't do important things. I have personally, unfortunately, seen where people have died because of wheelchair failures. And I think that's unacceptable when it could have easily have been maintained if there were coverage to do that. So waiting for something to break is not the way to do it. We all go to the dentist, or at least we're supposed to go to the dentist for a checkup every 6 months so that our teeth don't break, okay? Going to the dentist or bringing your car in for maintenance or inspection is pre-scheduled. So you're not, or you can ignore it and wait till you have a serious problem, and then you have to wait. My colleagues will talk a little more about the process of getting a wheelchair fixed and how complex that can be. But there's some very simple things in current policy that should be updated. For instance, not waiting for something to break before we can do maintenance. I think a 6-month or an annual maintenance check on a wheelchair will go a long way. We've looked at data also that how much does the wheelchair cost and how much is the cost of ownership. We don't have a very specific number yet, but somewhere between 20 and 30% on top of the acquisition cost. So it's another 20-30% of ownership. I've been working with legislation in Connecticut where Medicaid just recently shared that they spent $10 million on these wheelchairs. And then the repair claims are $2.3 million. So that told me, hey, 2.3% or 23% seems reasonable. Now, the question is going to be are we going to be spending more money if we pass this bill? It could be, I don't know. I would like to see that 2.3 million in Connecticut or whatever it might be here in Pennsylvania, a $4 can of motor oil can save you a $4,000 engine replacement is a way to look at it. Maybe we shift some of that repair cost, which is always done in a reactive situation, versus let's put some money into bringing chairs in for inspection. Now, the other complaint or the other problem we have is when repair techs go to address a catastrophic failure, they have to go to the person's home. They don't get paid for travel, and my colleagues will talk more about that. But I think here we've got opportunities to do something preventative. And if it's preventative, maybe more people will be able to bring their chairs to a repair place or a shop for inspection and not be stuck at home waiting for someone to come and see them. The timelines are also not appropriate when it comes to getting repairs. You have to get a physician to verify that the person still needs the wheelchair, even though they may have spinal cord injury or some kind of progressive disease. The physician has to verify that the chair is broken, the supplier often has to get prior authorization. That whole process can take months. I'm an assistive technology user myself. I have low vision. I use a computer with a screen reader and all kinds of other things. When my equipment fails, I can't wait weeks. I would be out of a job. I need to have a backup system ready to go at all times. And that's the other problem with these wheelchairs. They're so custom configured, you can't just borrow someone's chair. It's sort of like a prosthetic limb. I can't borrow my friend's prosthetic limb when mine's broken because the socket size, the length, and all that is really important. Again, these are not the wheelchairs you see in the airports or people being pushed around in hospital. They're highly complex, custom fitted devices. Now, with the research I've just cited, we've done a lot of studies that have looked at what are best practices for wheelchair service delivery. The Rehabilitation Engineering Society of North America, or we call it RESNA, they're the ones that certify us. There is a wheelchair best practice document out there. I was part of it. It's been around since 2011. We've recently done research, stakeholder engagement surveys, asking people how satisfied they are with this process. Over 1,000 people responded, and nobody's happy. The clinicians aren't happy, the manufacturers, the suppliers, even the policy people aren't happy. The most dissatisfied are the consumers and their caregivers, okay? So we failed, is the way I look at it. We've got a best practice document, but a best practice document is only as good as what policy is willing to include in that to make it enforceable. We've also got a recent document we put together from the International Registry of Rehabilitation Technology Suppliers. This is the group that oversees the suppliers and the repair people. Finally have a best practice on repair and maintenance, and it clearly maps out the best ways to provide repairs and when to do the repairs. If we know predictively when things are going to break and we know how much they cost, we can plan for that. We can keep inventory of parts based on what we know is out in the field and what's going to come in for repair at different given times. But without any policy or funding or business model to do it, it's just not being done. We found that in this whole process, aftercare, which is follow-up, reassessment, outcome measure, is completely ignored. Aftercare almost doesn't even exist in this area of service. The clinicians, myself as an occupational therapist, it's so hard for us to even do follow-up because the way funding is set up to provide for rehab services is designed around a plan of care that should take about 90 days. 90 days, your patient should have been cured or is now better. Well, this population, they're not getting better. They're not going to be cured. It would be great if we could, but it's almost like we have to keep these plans of care open throughout the rest of their life, and we can't do that. Consumers can't even use their medical transportation to get to a repair center. They have to, the medical transportation is only for medical appointments. The supplier is not viewed as a medical provider, which is not correct. So these are medically prescribed devices that are needed for medical reasons, and we have to improve the efficiency of how that's done. So I think there are plenty of opportunities here where we can look at those best practice guidelines. The maintenance, repair, wellness check may not solve all the problems. We've got a lot of work to do, but I'll tell you, it'll make a pretty big dent in the process. If we can't take care, the problem's not that complicated when you look at it. All we have to do is maintain the equipment. I mean, we all learned that with every other appliance we have. If we can't do that, we can't figure that out, then we failed. What's the point of the Americans with Disabilities Act? What's the point of deinstitutionalization if we can't keep people's equipment running correctly? And we can all work as partners. Everybody's got responsibility here, especially the consumer and their caregivers, that we can get this done. And we hopefully see a day where chairs are not breaking as much as they are. People are able to go out, feel comfortable getting a job, going to school, doing things because their wheelchair is reliable. Thank you.
Thank you. Thank you, Doctor, for that information. And yes, I did forget to mention it. I do have House Bill 183. So, yeah, that's right. I wrote that bill. So thank you with it too. Also, the doctor did a great job of introducing himself. So I apologize for not reading what my staff put in front of me. But Matt Berwick, I will read. Just briefly, Matt, and for those who don't know, Matt has been with the summit, I think, every year. I've lost track of how many times he's shared his expertise and his personal stories when it's relatable. But Matt's been a great partner. Thank you, Matt, for always advancing issues and being part of the team. Matt is the Senior Program Manager for Disability Accommodations for Clinical Services in UPMC's health system. He's the President of the United Spinal Association of Pittsburgh, who are in the resource fair. Right, I saw it. And of course, like I said, he's incredibly active. It is difficult to imagine so much of the advocacy that has been in Allegheny County and the state without Matt's leadership and involvement. So Matt, thank you for all that, and thank you for being here today to share some more insight.
Thank you, appreciate it. So hello and good afternoon. I come before you today to shed light on an often overlooked aspect of the well-being of people with disabilities, and that is the aforementioned wheelchair wellness checks, as we're calling it. My name is Matthew Berwick, and as Dan mentioned, I'm the president of the United Spinal Association of Pittsburgh. United Spinal Association of Pittsburgh is one of 4 chapters in Pennsylvania, and our collective mission is to empower and advocate for people with spinal cord injuries and wheelchair users to achieve their highest quality of life. While we often prioritize the health of our bodies, we must not forget the vital role that mobility aids play in enhancing the quality of life for individuals with disabilities. Wheelchairs in particular serve as a key tool for providing freedom, independence, and access to the world around us. However, like any piece of equipment, wheelchairs require regular maintenance and care to ensure that they remain in optimal working condition. Imagine for a moment, if you will, the impact of a malfunctioning wheelchair on an individual's life. It's not merely an inconvenience, it's a barrier to independence and participation in daily activities. A flat tire, a loose bolt, a malfunctioning brake can turn a simple outing into a daunting and potentially dangerous endeavor. For many wheelchair users, their mobility devices serve as not just getting them from point A to B, but it's a lifeline, a conduit to freedom and autonomy. Oftentimes, what we see is wheelchair users do not have the opportunity to engage with their wheelchair suppliers to ensure that their wheelchairs remain in working order, leading to catastrophic failure, requiring long periods of time where they're stuck at home, unable to be active members of their community, missing important events, and having to take time off of work. Let me take a brief minute to share a story about a person who's in this very situation. Wheelchairs have many pieces and parts, and all of them have to be in working order for a wheelchair user to be successful. However, even the most diligent wheelchair users may not be aware of the intricacies of their wheelchair and be able to independently maintain it. One of our chapter members was at college, and due to the lack of wheelchair wellness checks, had a malfunction to one of his smart wheels. So a smart wheel is a device that assists with propulsion. This left him stranded at the bottom of a hill and had to rely on the kindness of strangers to get him back to his dorm room. Because of this catastrophic failure, he was unable to move around campus and was stuck in his dorm room. Although the repair was covered by his insurance, it took the supplier a month and a half to order the parts, receive them, and repair his wheelchair. This is just one example of why wheelchair wellness checks are so crucial. Much like checkups by a physician, these assessments ensure that wheelchairs are in proper working order, minimizing the risk of breakdown and ensuring the safety and well-being of their users. During these checks, trained professionals can identify and address issues before they escalate. Turn the page. Performing routine maintenance adjustments and identifying these areas of needed repair keep the wheelchair functioning smoothly. However, despite the evidence which shares the importance of these wheelchair wellness checks, their existence is a significant barrier, which is the lack of insurance coverage. Passing legislation to mandate insurance coverage for wheelchair wellness checks is not just a matter of convenience, it's a matter of basic human rights. It is about ensuring that the individuals with disabilities have access to their health care that they need to have a fulfilling and healthy lives. It's about recognizing their dignity and worth as members of our society and providing them with the supports they deserve. Moreover, wheelchair wellness checks go beyond mere maintenance. It also serves as an opportunity for education and empowerment. Many wheelchairs may not be aware of the signs of wear and tear or the proper maintenance techniques in order to keep their devices in top shape. These checks will provide the individual with a learning opportunity to learn essential skills about basic troubleshooting and preventative care and maintenance, empowering them to take an active role in the maintenance of their mobility devices and independence. Furthermore, wheelchair wellness checks contribute to the overall health and well-being. A well-maintained wheelchair reduces the risk of musculoskeletal injuries caused by poor positioning or improper seating. It promotes better mobility and circulation, reducing the likelihood of secondary health conditions, such as pressure sores or circulation problems. It ensures that investing in the maintenance of wheelchairs is an investment in the health and longevity of the individuals who rely on them. In conclusion, wheelchair wellness checks are not merely a matter of convenience, they're a fundamental aspect of the health care for individuals with disabilities. By prioritizing the maintenance and upkeep of wheelchairs, we're upholding the dignity, autonomy, and well-being of wheelchair users and enabling them to live life to the fullest. Let us commit ourselves to promoting awareness, advocating for access, and investing in the health and safety of all of our members of community, regardless of their mobility needs. Thank you so much for listening to my testimony today.
Thank you both. What we're going to do is we're going to do some questions. So I do have a couple, and I'll be looking for my colleagues as well before we move into our next two speakers. Doctor, you had mentioned that another doctor, a physician of some type, has to certify that the wheelchair is still medically necessary. Did I get that right?
Yeah, if they haven't seen, this is a Medicare guideline that sometimes is adopted by the states. If you haven't had a face-to-face visit with your physician in the past 12 months.
Okay. Like, what if though the wheelchair user is never not going to need the wheelchair? Does that requirement still exist?
So if I could repeat what I think you're saying is if they don't need the wheelchair anymore, then no, they don't. No. They're always needed.
They're never not going to need it.
Right. These are individuals who have permanent, in most cases, permanent and progressing conditions.
So they still have to have the physician sign off?
Yes.
Even though that's never going to change?
Correct.
Okay. Is that what Pennsylvania does?
I believe, I'll defer to my colleagues who manage the claims. Yes, that is the case. Yeah. And even if it wasn't required by Pennsylvania, what I've also noticed as a clinician, there's so many funding sources out there, so many different health plans, that you pick the lowest common denominator and apply it to everything.
Well, that's great.
Yeah.
All right. Before we go to Joe here with a question, I just want Em to introduce herself, Em, and please tell us where you're from.
I'm Emily Kincaid. I represent the 20th House District, which is parts of the north side of Pittsburgh, North Hills, Ross Township, Bellevue, Avalon, Westview.
And that's Pennsylvania, not New Jersey. I thank you both for coming before us. And I have two questions. One relates to proprietary technology or proprietary designs with wheelchair repair. How do we handle that? You know, when we have to fix our cars, sometimes the warranty doesn't apply if you don't go to the Lamborghini dealership, right? But I'd like to know how that plays out. How a hybrid, a U.S.-made hybrid. So that's one question. How are we handling this different level of technology, some of which is proprietary? And second, is there a way to be researching these and providing studies that will let insurance companies know that paying the upfront, $4 FRAM oil filter versus the $4,000 engine repair? And yes, I'm dating myself with that reference. But letting insurance companies know that ounce of prevention does equal all of the money that would be spent on additional health care as well, because that's where our opposition
Right.
is coming from.
Yeah. So to your first question, the supplier of the device is different often from the manufacturer of the device. The suppliers typically that work in this area carry all the manufacturers, so that first issue is not a problem. In instances where that does happen, then yes, you would take your device to that Lamborghini dealership or whatever where they are qualified. We like to have all of our suppliers using qualified technicians who can work on most all of the chairs, and the manufacturers training them on those devices and continuously training them as they update the equipment. So I don't think that's going to be as much of an issue. To your other question, we've never really studied this in the United States. Like our group at the University of Pittsburgh, and I'll say University of Pittsburgh is probably the premier institution in the country when it comes to wheelchair research. We're starting to get that sense. There have been studies done in other countries where wheelchair maintenance is part of routine care, and I've seen those studies out of Sweden especially, who actually did a randomized clinical trial many years ago and said, let's put this cohort into a continuous maintenance protocol. Let's just let these other people do what we routine care, which is here's your chair, call us when it breaks. In the control group, there were amazingly almost no adverse incidents. There were no failures, no accidents, no hospital readmissions. That's something that we really want to look at. We are also looking at large data, claims data. Medicare public use file, maybe we can also work with Pennsylvania Medicaid, looking at incidents of repairs, what types of wheelchairs people are getting, if they're getting good care, are we also now seeing a reduction in claims related to falls and other adverse events? But we're working on it. We're not quite there yet. But at the same time, common sense tells us if you don't maintain something, it's going to break. Yeah. So
Thank you.
yeah.
Thank you for the question and the answer. Dr. Arian?
Thank you. So understanding that not all wheelchairs are created the same, and can you help us understand the highest level of technology? Like, what is it capable of doing in terms of alerting someone that something is going wrong, right? So like you used the car example. I know when my air in my tire is going to go down because the light pops up, right? Or I know if I need an oil change. Like, what type of technology advancements do some people have in their wheelchairs that can at least give them that heads up that like their tire is low?
Good
does that
question.
exist?
That's something and you'll see it with some of the chairs I'm going to show here in a minute. But that technology is emerging, and some of our higher end manufacturers are starting to pay attention to how can we incorporate some of the same technologies we have in the automotive industry. I mean, my furnace sends me a text message saying, change the filter, clean me, you know. And if I don't respond, they nag me. So it's the same thing, right, with a lot of the wheelchairs are going to be connected to the internet. Some of them already are. There's this concept one manufacturer is called fleet management. I would like to see a day very soon where I have someone sitting in our clinic with a display of the hundreds of wheelchairs that are out there, looking for alerts, alerting the client, make sure the patient knows or the person using the chair knows, and then figure out what's the right course of action. Right now, we just depend mostly on how old it is. And that's not really a good gauge either, because you've got people, we know from our research about a mile a day is what people put on their chairs. But I have people who put 5 miles, 10 miles a day. And I have some people that only use their wheelchair once a week. So that's not a good gauge either.
So right now, that type of integration is not widespread.
It's just emerging.
Just emerging.
But,
Thank you.
But if we could create a good business model for repairing chairs, you'll see that technology move a lot faster, because a lot of our suppliers don't necessarily embrace it because there's no business model. Yeah.
Thank you. Anita?
Thank you. I don't have a question. I have a comment, though. I want to thank you. And Dan, thanks so much. I'm in a position now with my brother where I will now be looking for his first motorized chair. He suffers from MS, and for the past year and a half, he has been wheelchair bound. And we finally talked him into considering one, and you've just made my head explode because, just thinking about what I'm going to be looking at for him or the things I'm going to have to consider. And this is fantastic, and if Dan has a model, because my brother's on Medicare, with his disability, and if we have legislation coming up, I'm all in. And really just to thank you. I never thought of all these things. I just thought, you went online or you went to a store and you bought a chair, and I put him in the chair. And to think that it's going to need to be or should be fitted to whatever position he's normally in, or et cetera, is a lot. And I know it's got to be a lot for families who have to deal with this.
Absolutely. And that's why it would be good to go to a professional that knows wheelchairs and can help in that decision making. Because the same person with the same diagnosis doesn't always get the same chair. It's where you live, what you do, what your needs are, what you can tolerate, how you're going to get it fixed. What's it going to look like. And then if you're dealing with something like MS, unfortunately, we know there's progression associated with that.
And of course, Dan Miller bills are fantastic. I mean, everybody, we know that. All right, gentlemen, thank you so much for getting us started. We do have two more presenters that we're going to be talking with. One is Skip Katich. He's the Vice President of Government Relations and Legislative Affairs with Blackburns. He's the Executive Board Member of Pennsylvania's Association of Medical Suppliers. And the other gentleman is Vince DeMarco, who is a licensed physical therapist and assistive technology professional, oversees complex rehabilitation services in the post-acute care division of Grandview Health, which has provided over 700 specially designed wheelchairs and maintenance for individuals with disabilities. So, gentlemen, thank you both. Vince, you taking it first?
I'll start, sure. Thank you, Representative Miller, legislators and guests. We applaud and appreciate your continued support of House Bill 183. That's what it's all about, right? It's the whole repair thing. My name is Vincent DeMarco. I'm a licensed physical therapist. Oh, now I can see now much better. And a credentialed assistive technology professional, or what is called an ATP. I'm employed within a hospital system in southeastern Pennsylvania in a small department focusing on complex rehabilitation technology, also known as CRT. We provide approximately 70 complex rehab technology wheelchairs to customers per year. And our company currently serves an average of 700 medically complex individuals. The patient population is comprised of approximately 65% of individuals with intellectual and and developmental disabilities, as well as about another 20% with aging deformities, another 10% who are experiencing progressive neurological disorders, and 5% or so with traumatic head trauma and paralysis. These individuals depend upon their wheelchairs for everything. I mean, we've heard testimony about that, but I'm just going to highlight a few things. Proper positioning when out of bed, employment opportunities, attending workshops and educational centers, socializing with family and friends and colleagues, attending medical appointments and community activities, really everything that's going on in their lives. To keep this in perspective, it can take approximately 3 to 5 months from initial evaluation to delivery for the individuals to receive a complex wheelchair like the ones that are behind you right now. We can talk about that later. To provide complex rehab technology services, it requires a vast team of professionals, including but not limited to physical therapists, occupational therapists, speech therapists, doctors, engineers, social workers, family and care providers. The complex wheelchairs are designed specifically for the individual and the individual's functionality within the community and society in general. I would like to review how the repair process affects the users when their complex wheelchairs become damaged or unusable. As Mr. Berwick shared previously, there can be a multitude of reasons for a complex wheelchair to malfunction unexpectedly. The type of repairs needed can be diagnosed quickly. However, in some cases, getting the actual repairs completed can take from weeks to months, based on the availability of replacement parts, along with insurance authorizations and the logistical planning needed to have the complex wheelchair either brought into the clinic or for the technician to go to the patient's home. At a time when there is an unanticipated breakdown with the chair, our repair technicians would also need to add an unplanned stop at a consumer's place of residence to assess the equipment. The usual process for handling a complex wheelchair repair starts with the supplier receiving a call about the potential problem. We then schedule the wheelchair for a diagnostic visit, either in the user's home or at our company office. If it's determined that a repair is needed, we contact the manufacturer for the replacement item. We receive a quote as needed. It should be noted that if the wheelchair is determined to be completely inoperable at the time of the initial diagnostic review, the user may be provided with a loaner, but as you know, it's not going to be the specific dimensions as what was originally designed for the patient to begin with. We may need to obtain a written prescription and other documentation from the ordering practitioner that indicates the repair itself is reasonable and necessary. And we have to document details describing the need for and the nature of all the repairs that we do. In addition, depending on the insurance, we may need to obtain a prior authorization for the repairs. Once approved, the parts are then ordered. If the request is denied, we need to appeal that decision with additional documentation and other steps that we have to go through. Upon arrival of the replacement parts, the user is scheduled for a repair clinic visit or an in-home repair. The repair is performed by the repair technician. If any adjustments are required for the user's seating and positioning, the ATP would assist with that clinical process. The assistive technology professional and the repair technician collaborate on repairs. For example, our repair technician has nearly 30 years of complex rehab technology experience. He increases his knowledge through online programs, manufacture in-services, and dialoguing with technical assistant representatives for the types of wheelchairs we provide. He works in conjunction with the ATP to provide the most effective service and care for the consumer's equipment. He is responsible for complex manual and power wheelchair repairs. Depending on the severity of the repairs, technicians may need as little as 15 minutes or up to several hours for completion. Reimbursement for these repairs varies according to the payer source and contractual obligations. The goal of House Bill 183 is to reduce or prevent catastrophic failures with a complex wheelchair. This could be accomplished by timely preventative maintenance checks twice a year. These types of checks that are performed for manual wheelchairs may include inspecting any loose parts, analyzing the frames for fractures or damage, inspecting leg rests for proper mechanics, checking the front wheels, the casters, bearings, axles for proper functioning and assessment and any damage and wear. Inspecting the anti-tippers to make sure that they work properly so the patient does not fall backwards in the chair. Assessing that cables, attachments, braking mechanisms are functional and checking for wear, making any necessary adjustments. Inspecting headwear, positioning hardware, belts, accompanying hardware, inspecting custom seating, backing, armrests, padding for integrity. For powered wheelchairs, we assess similar aspects as with the manual wheelchairs. Plus, we would determine the functionality of the motor, the cables, any attachments for any wear or other problems. We would also inspect the electrical components such as the power tilt, the power recline, the seat elevation. We would also inspect the driving pattern and response for the wheelchair and ensure that the batteries and the cables are functioning. In conclusion, performing scheduled complex wheelchair well checks will enable the identification of potential issues prior to prevent catastrophic breakdowns that would severely impact the well-being of the wheelchair user. Thank you.
Thank you, Vince. Skip?
Thank you, Representative Miller, panelists. We greatly appreciate the time you're letting us talk about House Bill 183. House Bill 183 would help ensure the safe operation of a consumer's complex rehab wheelchair to avoid a total catastrophic breakdown. It could leave them without mobility for days or even longer. The bill would provide reimbursement for commercial payers and PA medical assistance for up to 2 wheelchair well checks visits per year and help ensure continued safe operation of the equipment, as my colleagues have stated before. We have brought a few types of wheelchairs to demonstrate the difference between the simple manual chair, which is the wheelchair which would be on your far right. That wheelchair would not be included in a well visit chair. That is for a basic wheelchair user. The other chairs are, you have your power chairs and you have manual chairs. The pink chair is showing you a manual chair that also has custom seating. It's molded specifically for the patient, for their deformity, to give them the proper adjustments that are needed. And Vince and my other colleagues can go into that further of the operations of the chairs and everything for you. The yellow chair also does have tilt. It also has electronic controls on the back for the patient's assistants to help them, their caregiver, in case they're not able to operate or they're in a tight corner. So there are many different types. The leg rest will elevate. So some of the basic, these that we have brought for you and showing that the basic chair is not included is, I feel, very important because it does not include all types of wheelchairs. It's only specializing in the complex rehab wheelchairs that are used throughout the day that have the most catastrophic breakdown and cost the most for us if we're on medical assistance or commercial insurance, the most. Standard wheelchairs are designed for part-time and intermittent use patients. That would be the wheelchair on the right. As Mr. DeMarco described, there are various components that could fail and lead to catastrophic failure. On some of the power complex wheelchairs, we got to check the batteries, the joysticks, the tires, the wheel assemblies, the brakes, the armrest. A simple armrest that has a crack in it, if a patient continues to use it, they can develop a sore. If that sore goes unattended, it could be, that gets infected. It could create a hospitalization or even the seating and the positioning as well. The proposed bill would allow for the 2 preventative maintenance checks to be performed by a complex rehab technology provider, repair technician. We have received questions from legislators and community about the education and training of our repair technicians. Our providers are required by Medicare to employ at least one trained technician per location, in addition to one credentialed assistive technology professional, or ATP. And that's part of our Medicare compliance guidance that we have to do. Repair technicians, per the Medicare requirements, can program and repair sophisticated power chairs, electronics, alternative power drives, controls, power seatings. The roles require that our repair technicians complete at least 10 continued education hours annually related to complex rehab technology. And they obtain the experience through on-the-job training and from manufacturers on the products that we supply. It's our providers' responsibility to do that for the patients that we're servicing. Stakeholders have also asked if these well visits are just a way for users to obtain a new complex wheelchair earlier than needed. The answer is no. Power wheelchair users or complex wheelchair users do not want new chairs. It takes them a long time to break them in. It's just like my grandfather that had his recliner chair. It's broken. He doesn't want a new chair. He wants his chair fixed. Users do want their wheelchairs to be reliable working condition to avoid the stress and disruption of breakdowns. Access to timely wheelchair repairs has become increasingly difficult over the last few years due to supply chain disruption, labor shortages, which is a continual battle for a lot of employers, documentation delays, and inadequate reimbursement for wheelchair repairs and service items. Well visits could help identify potential problems before a catastrophic breakdown. Another primary question pertaining to how complex rehab technology providers are paid currently for well visits. We have stated previously there is no current reimbursement structure for the payment or performance of the complex wheelchair well visits, as my other colleagues had stated. There is a payment for repairs and replacement parts and associated labor. However, there is no reimbursement for preventive maintenance and checks. As an example, currently under the PA Medicaid reimbursement repair or non-routine service of durable medical equipment, which includes complex wheelchairs, we get paid $6.25 per 15 minutes. That is $25 an hour. The number of units bills depends on the actual amount of labor that would be needed to do the repair. Parts are reimbursed separately. One of the major things I think we all have to understand is we do not get paid to do a service call. So that time that my driver has to leave our location, and he could have to drive 30 minutes, 40 minutes, 50 minutes to do that repair, we don't get reimbursed. We only get repaired for labor from when we're fixing the chair. So we may be identifying other components, but we're only getting paid for the part that we're putting on that chair. Other important questions have been asked about other states involved. How are they handling the situation? Currently, Tennessee and Iowa, Connecticut, South Carolina, Vermont, Michigan, and California have legislative language in bills that have been introduced this year to provide preventive maintenance for CRT wheelchairs as of House Bill 183. Other states, such as Colorado, have introduced right to repair or similar legislation and does not fix the problem. House Bill 183 actually is a real solution. Thank you, Representative Miller. In conclusion, complex custom-fitted wheelchairs require ongoing maintenance and adjustments, no different than any other device or appliance, such as an automobile or furnace. Most users are unable to perform these repairs or maintenance on their own, nor would it be safe for them to do so. Most require the skill of a properly trained certified technician. PAMS, as our state association, as well as other provider communities, support House Bill 183 as routine maintenance will likely reduce costly catastrophic failures and adverse events. We greatly appreciate your time in letting us present to you today.
Well, thank you, gentlemen. I want to first let Senator Costa just say hello, introduce himself. Of course, let us know his district. Jay?
Thank you very much, Rep. Miller. Jay Costa, State Senator representing the 43rd District, which encompasses about half the city of Pittsburgh and some of the eastern suburbs and southern communities in Allegheny County. I have the pleasure of serving as a Democratic leader in the Senate, and I really appreciate to be here, and I apologize for getting here a little bit late. I was with Secretary Siger on an economic development panel, so I apologize for getting here late. But thank you, Dan.
Thank you, Jay. And look, I know we have another panel that's coming in. I'm going to invite any one of my colleagues as well if they want to step up and just take a quick peek. I just want to take a look to be sure that you could tell us what we have here for a moment. We obviously have a series of chairs. I know you made reference, and anybody who, can grab the mic here with
Sure.
it. Again, this is the basic.
That's the basic chair. That's basically one chair fits all.
Okay. What about cushions on chairs? I thought, is there something separate that happens with cushion replacement?
Yes, there is. Yeah, that cushion, again, has to be specific towards the chair that's being reimbursed by the insurance. You can't get a cushion if you don't have a chair.
And how often can you replace a cushion?
I'm not sure.
Well, we would have to it's 5 years, unless if it's before then, we would have to show proof that that it's not holding its function anymore.
Okay, this one here obviously looks like it has a little more capabilities in some.
Yes, that's a power chair. It's a group 3. All power chairs are designated into categories, and that is a group 3, and it's based upon the medical diagnosis of the patient. So you have to have a progressive neurological diagnosis to be at least considered for that type of chair.
Is this the most expensive chair you have up here?
Yes, it is.
And what would this sort of run?
Yeah, about at least in the 30s.
30.
Yeah.
Okay. What do we got here?
I believe that's what we call a Tilton space chair. It's usually for someone either intellectually or physically disabled. The cushion is molded, and I could certainly show you that process afterwards, but it's a molded back. It's for people that have deformities, that the back is actually kind of like a beanbag chair, and the air gets sucked out, and the patient sits in there, and the mold is then taken from that, and that's how the cushion is processed and made.
Okay. What about here?
I think that is just an ultralight wheelchair. It's called a K5 through insurance purposes. It's probably around 20 pounds, 25 pounds. Someone that is much higher level of functionality, you'll see them in that style chair.
And this one?
And that's a group 2 power chair. That's just gets you from point A to point B. It doesn't have any tilt, any power legs, any recline electronical components whatsoever, where that one does.
And so this one can lift up?
That grouping can lift up, but that one right there does not.
Okay. All right, so 30,000, and on the low end, what would be maybe these two?
The non-skilled chair, I'm going to say $400 to $600.
Okay.
And that's if you should sit in it, God forbid, or if I should sit in it, right? It's one chair fits all. If you get out of the hospital, that's what you're going to get. Regardless of your diagnosis or anything, that's what they would get.
Well, thank you. And obviously the main point of why we were doing the bill, one of the main points, is that some of these things are not easy to cover, right? So you can't just walk in for some people and be like, yeah, I'll be able to drop $30,000 on a new chair today. So, yes. Well, listen, I want to thank you. Seeing no further questions, thank you, everybody, for talking about House Bill 183. We definitely appreciate it.